Good morning and welcome to the second annual State of the Region, brought to you in partnership with Rotary, Waterloo Region, and Disabilities, both great organizations in our community. So I really do hope you had a chance to check out their booths this morning. I'm Nicole Lampa from CTV News, and I will be your host today, where you will get a chance to hear Regional Council's vision for Waterloo Region beyond COVID-19. But before we get started, I wanted to review this morning's format for the event. Obviously a virtual one. So this year, the washrooms and refreshments are unfortunately within your own homes. We hope and believe that will not be the case next year. So this morning you will hear remarks, watch a video, and then there will be a fireside chat with Chair Redmond. And then after that, you will have the opportunity to network with regional councilors in the expo, where there will be booths dealing with topics that are very important to our community. They include sustainable transportation, affordable housing, business supports, and equity and diversity. So let's get started. I have the distinct pleasure of introducing Louise Gardner. She is the president of Kitchener Rotary, and she has been a member of the organization for the past 25 years. And she really truly does embody what it means to be a Rotarian. During her 40-year career, she was well known in the retail travel industry, where she became the executive leader of Carlson Wagonli's North Division for its leisure department. And when she retired in 2019, she didn't stop. She continued as a part-time professor at Conestoga College, where she continues to inspire young students who want to follow in her footsteps in the travel industry. And most recently, she was appointed as the vice president of the Agency Solution. It's an organization that helps small travel agency owners help revitalize their companies. We are truly honored to have Louise Gardner come to the stage and talk to us about some of the great work that Rotary Waterloo Region does for our community. Welcome, Louise Gardner.
Thank you, Nicole. Thank you so much. Well, on behalf of the Rotary Club of Waterloo Region, I'd like to personally welcome you to our State of the Region event. Once again, we are thrilled to be your hosts for this annual event. We live in a great region, and this event is a wonderful opportunity to make connections with so many different members of our community from all sectors: business, education, volunteerism, and community service. When talking about the importance of opportunities and making connections, this also is a message that's central to Rotary. Each year, Rotary adopts a theme, and this year's theme is Rotary Opens Opportunities. Our region has so many opportunities to work together, and Rotary is an organization that has made a significant impact in our community for close to 100 years. In 2022, Rotary will be celebrating 100 years of service to the KW community. We are in the planning stages for events to celebrate this milestone and recognize the aspects of our community that were made possible through the great work of Rotary over the past century. One of the most significant achievements has been the work with children with disabilities. This was the very first project undertaken by Kitchener Rotary in 1922. Over the years, this effort led to the establishment of what was originally named the Rotary Children's Center in 1957, and which eventually became Kidsability, which today is a thriving hub empowering children and youth with a wide range of complex special needs to realize their full potential. Waterloo Region Rotary's work continues to this day in raising funds to support Kidsability, and we're happy that there's an opportunity for you to donate to this wonderful center as part of this event today. Did you know that Rotary has been instrumental in supporting, and in some instances even saving, local organizations in our region? The list is long and includes African Canadian Association of Waterloo Region, Anishinaabe Outreach, and Selma House, Canadian Clay and Glass Gallery, Children's International Summer Village, Computers for Schools, Engineers Without Borders, Family and Children's Services Waterloo Region, Food Bank of Waterloo Region, Independent Living Center, and the list goes on. Junior Achievement, Kids Sport Kitchener-Waterloo, KW Musical Productions, KW Symphony, Mennonite Coalition for Refugee Support, Muslim Social Services Kitchener-Waterloo, Nutrition for Learning, Out of the Cold, Ray of Hope, Registry Theatre, Roof, St. Monica House, the Kitchener-Waterloo Art Gallery, and all of our hospitals. And the list just goes on and on. Our support not only includes grants and funding, but also hands-on volunteering. Our motto is service above self, and we thrive by doing good in our community across the region. You've seen us out there, selling car draw tickets at the market, delivering turkeys and orange crates at Christmas, or Rotary roses for Thanksgiving during our fundraising drives, holding Skate 48, Mud Puppy, Superhero, and Classic fun runs, golf tournaments, raffling off vacation fantasies, collecting and selling goods in an online Rotary auction, at Lobster Fest and Rib Fest, and other tasting events such as in Vino Caritas and Best Bites. We've planted trees, we've cleaned trails, we've adopted roads. If it needed to be done, we did it. And I would bet that most of you have somehow touched Rotary in some shape or form across the region. And for this, we thank you, as your support is always crucial to our successes. Rotary also supports international work around the world, and we support 7 areas of focus across the globe: basic education and literacy, maternal and child health, peace and conflict resolution, water and sanitation, disease prevention and treatment, the environment, economic and community development. If it needs to be done, Rotary's there to do it. Disease prevention is a major focus for all Rotarians, and Rotary International has been working to eradicate polio for more than 35 years, and we've made incredible progress in the fight to rid the world of it forever. As a founding partner of the Global Polio Eradication Initiative, we've helped to reduce polio cases by more than 99.9% around the world. There are only 2 countries left where it remains endemic. Our stories are many and stand out in terms of the difference that a small number of people can make connecting with others in the world. And as you've heard, Rotary in Waterloo Region continues to play a central role in the local and global communities. We are focused on making new connections and finding new opportunities to serve. We encourage everyone who's here today to reach out to us, whether it's to volunteer with our local projects, our international initiatives, or simply to help in building new relationships. We would like to consider you a friend of Rotary. And I'd like to extend an invitation for you to visit us in the expo this morning and to attend a meeting sometime over the next year to learn more about Rotary and how you can become involved. Please reach out. I think you would all make great Rotarians. And now it is my pleasure to introduce Karen Redmond, the chair for the region of Waterloo. Karen has been dedicated to public service for more than 20 years. She's represented the community at several levels of government, including federal, municipal, and the Board of Education. Prior to being elected as chair, she served on regional council as a representative for the city of Kitchener. Among her professional endeavors, Karen served as Chief Executive Officer at Habitat for Humanity Waterloo Region from 2010 to 2018. In other community activities, Karen has served as chair of the Independent Living Center of Waterloo Region and as a board member of Martin Lutheran University College. Karen is also an elder at St. Andrew's Presbyterian Church in Kitchener. She is a recipient of both the Queen's Jubilee and the Queen's Diamond Jubilee medals. Karen was president of my Rotary Club, Kitchener Rotary, in 2014-2015. She is a lifelong resident of Waterloo Region. She currently resides in Kitchener, and she and her husband Warren have 4 grown children. And now it gives me great pleasure to introduce our regional chair and my friend, Karen.
Thank you, Louise, and good morning. Thank you, everyone, for joining us today for the 2021 State of the Region Address. I would like to officially begin this event by acknowledging that the land on which we gather today is the land traditionally used by the Haudenosaunee, Anishinaabeg, and Neutral people. I also acknowledge the enduring presence and deep traditional knowledge and philosophies of the Indigenous people with whom we share this land today. What I have learned from our Indigenous people is that our relationship with the land is not one of ownership, but stewardship. When I first met Clarence Kakagi from the Chapleau First Nations, and he now calls Waterloo Region home, he shared his vision with me about building a sweat lodge available to all Indigenous people and a large open space so that they could enjoy being on the land. I asked him what I might do to help, and he said very simply, walk with me. I am humbled and honored to walk with our Indigenous people. I want to thank the Rotary Clubs of Waterloo Region for the wonderful partnership this year. It was their idea and the leadership of Paul Pupolo and Howard Powell last year that brought this event together. And I'm glad we're able to make it an annual affair, even though the new reality is we're virtual. I've been a member of Kitchener Rotary since 1997. And when I had the opportunity to join Rotary as a regular member rather than an honorary member, I did so without hesitation. I had witnessed the impact Rotary has internationally when I was vaccinating against polio in India with colleagues from Cambridge Rotary Clubs. And when my husband and I visited our daughter Laura as she concluded her 6-month volunteer position working at HIV/AIDS orphanages in South Africa, the orphanage had been built by my Rotary Club. Kitchener Rotary Club had helped build that. Waterloo Region Rotary Clubs have significant impact here at home. Since the 50s, Kidsability has had a transformational impact on our community. I know it's hard to do virtually, but if we were all together, about 80% of us in attendance would raise our hand to indicate that a family member or a friend's child had received the support of Kidsability. Donations from today's event will support this essential service for families in our community and in Guelph. Louise already mentioned Rotary's model, service above self. From my perspective, public service has always been the inspiration for public office. This commitment to the community, to the public good, is shared by my regional colleagues who will be in attendance at the breakout booths to discuss key priority areas with you as part of the program this morning. At last year's event, I spoke about the grand story of Waterloo Region. I compared Waterloo Region to the Grand River. Like the river that flows enduringly, I said Waterloo Region is always, always resilient. I didn't know it then, but what a timely reminder as we headed into and remain in a period of uncharted waters. We've faced challenges that we never could have imagined, but we continue to show the resiliency for which we are known. We continue to build a community, not just for today, but for future generations. We'll talk more in the Fireside Chat with Nicole and in the breakout booths with members of Regional Council about how we're building on the history of resilience and forward thinking to plan beyond COVID-19, to plan for a world-class community for all our residents. With vision and leadership from Regional Council, we're developing a transformational plan to improve the lives of every person in Waterloo Region. Every single one. It's not a short journey that we're on. We must recognize that. There are uncharted waters and turbulent waters ahead. The path is long and winding, with many decisions to be made, much input to consider, and many, many voices to be heard. But we're committed to continuing to build a community that's rivaled across Canada and beyond. In a moment, you will have an opportunity to watch a short video that speaks of some of our vision. I've watched this video numerous times over the last few days. I'm left with a very strong feeling that there is hope. Hope because we have a vaccine, several vaccines, in fact. Hope because we're committing to leaving nobody behind in Waterloo Region. Hope because of the great work of our regional staff. Hope that we are working to build the best possible community where everyone is welcomed, where everyone has a roof over their heads, where everyone has a voice, where those voices are heard. The 4.5-minute video will pop up on the screen shortly. Press the play button and raise the volume. And the upcoming video will also be available on YouTube and on the regional's social media channels shortly after today's event. Please share and enjoy. After the video, please stay with us on the stage area. and I will return with Nicole Lampa, our host this morning, for our Fireside Chat, and we look forward to seeing you there.
We're going to have a fireside chat now with Chair Redmond. We're just going to welcome her to the stage momentarily because I'm pretty excited. I know many of you are excited as well to hear what Chair Redmond has to say this morning. Good morning, Chair.
Good morning, Nicole.
We just watched a video, and I'm going to go off of that. It really, the first 5 seconds, 10 seconds really hit home with me. It really signified, one of the first moments of the pandemic for the region. Take me back to the conversation or where you were the moment you realized we are in for something significant.
So it probably started a little bit earlier. My husband and I had planned a trip to Vietnam that we'd really been looking forward to celebrating a significant anniversary. And it really was up until the day we left in February, whether we were going to go or not. And then when we got over there, I was very worried about whether or not we'd get back. So when I got back, I knew there was a pandemic. I knew that it was global. It really hit home to me when Mike Murray, who was CAO at the time, dusted off our pandemic control plan, which had been crafted after the experience with SARS. And it became real when it was St. Patrick's Day. I remember that significantly, that the province declared a state of emergency. And shortly thereafter, I think it was the 25th of March, the 7 area mayors and I all declared states of emergency. So we knew then that it was unprecedented and uncharted waters for sure.
Well, we did enter uncharted waters over the past year, and we're talking about hope today. But in order to look ahead, I think it's really important to focus in on some of the blind spots that were magnified in our community. That really shone a light on different areas. Can you pinpoint what was the first major blind spot for you that made you realize, okay, we've got to pivot and change things the way we have to do here in the region?
So I think it's often said, and I've said it myself as recently as a couple of weeks ago to the provincial finance minister, that collaboration and cooperation are really in our DNA. And I would sort of use that as an example for 2 of these gaps, Nicole. One of them was we realized that people needed one portal. So the Volunteer Action Center jumped in. We couldn't do anything without our community. And they became the access point for people who either needed volunteers or wanted volunteers. Best WR was formed for the business community, and that included the CEO of Waterloo Economic Development and the presidents of both Chambers of Commerce and Ian Klugman from Communitech. And their slogan was, "There's no wrong door." And as the months progressed, they were able to navigate those programs that were available both from the federal and provincial government for businesses. And boy, small and medium-sized businesses have really, really suffered. The other gap we realize is when I say about collaboration and cooperation, it doesn't include everybody in our community. And the disaggregated data showed us that Indigenous people, Black people, people of color, and people on low incomes were disproportionately impacted by COVID. And that really moved us to action.
You brought up something very important there, the segregation, the feeling of that. And, the Black Lives Matter really was a blind spot during the pandemic that came out, shone a light on our community. The Anti-Racism Advisory Group was formed as a result of that. What sort of suggestions have they put forward in order for you to take action? Because forming a group is one thing, but people want to see action.
So my observation would be, and I've been in politics a little while, I've never seen this level of civic engagement. And when we saw that march in civil society marching over the disadvantaged treatment and the systemic racism that Black people suffer in our community, we knew it was time for action. So Regional Council passed a unanimous motion, and there were several parts to it. One of them was about education for ourselves, facilitating education on these issues for our staff, and doing that in partnership with the 7 area municipalities. And I think that's really important, and that's ongoing. The other thing we did was we had a community conversation, and Colleen James facilitated it. And what came out of that was the fact that we needed to make action happen. Talking wasn't enough. So we consulted in the community, and again, Colleen helped with that. And we got 5 very wise people who formed a steering committee. And that steering committee then accepted applications to be members of the 11-person working group that you referred to. And I talked to a couple of people on the steering committee afterwards, and they said it was so much more work than they anticipated. There were over 70 applications. I think they chose wisely, and they also forged a term of reference for this working group. So we look at the working group as people who will inform decisions made by regional council. In our budget, which is just a few weeks old for 2021, we've put in $5 million in 2021 and another $10 million in the next year budget to deal with systemic racism, to look at the gaps and policies, practices, and procedures that we need to change both in the corporation of the region, as well as how the region interfaces with our community. We are absolutely determined that we are going to move the marker, and that there will be really results coming from the advice of the advisory group, as well as the investment we're making in the community.
You know, on top of helping the community, often the community will respond when they see someone sitting at the table who represents them. What sort of movement is being done to get more BIPOC individuals to run for regional council?
So there's been a campaign school run by mostly the community, and I've spoken at it. My colleague and friend Elizabeth Whitmer's spoken at it, and many councillors have. And I would tell you that that campaign school is really important for a few reasons. It was mostly targeted at getting more women in politics, but it also trains the people who support the candidates. And you know, Nicole, when I ran, I was an at-home mom, and I ran for the school board. And the people who helped me were the hot dog moms, the moms that volunteered in the playground, the people I taught Sunday school with. But that's what, those were the wheels that got my political aspirations going. So these campaign schools are great. I would tell you that I don't think the Black, Indigenous, and racialized people necessarily want to hear from people like me, but there's so many amazing leaders in the Indigenous community, in the Black community. And, you know, I think of a Marcia Smelly or Loris DaCosta or Chloe Callender, and those were the people that were breaking ceilings and pushing the boundaries when I got into politics. So there's an infrastructure out there, but it has to be deliberate and it has to be intentional.
You know, when speaking in regards to equality, there are some members in our community who have felt as though the language of some leaders have been divisive, particularly against those who suffer from mental health, addictions, and homelessness. What's being done to address the language to ensure that these people don't feel further stigmatized, you know, down the road?
You know what, I think it's incumbent on all of us to call it out when we hear it, and whether it's racism or it's disparaging words about people who are living with drug addiction. I think there's a real tend to try to make them the other, and what we realize is they're not the other. None of these statistics, whether it's people who have passed away from COVID or people who are dealing with the opioid crisis, there's somebody's child, somebody's brother, uncle, daughter, son, and there's real stories behind them. And I was really heartened when I first became chair. One of the things that we did for weeks and weeks was do community consultation on safe injection sites. And it was amazing to hear, and right across the board, it didn't matter what community we were in, people were saying, we need to look after these people. We need to recognize that the homeless people and the people that are suffering with mental health belong somewhere, and they do belong in our community. They need service.
Speaking of that service, the pandemic really shone a light on the homelessness issue, and the region had to act quickly, you know, in order to ensure that people were able to physically distance. Hotels were then used. Will we expect, and can you expect, since decisions were made so quickly, can we expect that same sort of pace going forward when dealing with the homelessness and affordable housing issue?
So again, a two-parter. The affordable housing, absolutely. We've put $20 million in our budget and land, as have some of the area municipalities, in order to animate partners in the community to create more affordable housing. As far as the shelter system, and it's really a continuum, right? You have homelessness, shelter, supportive housing, and affordable housing. And affordable housing can be a very, very elastic term, because I have friends whose kids graduated from university and have debt. And for them, affordability is a whole nother application. But the shelter system, I really hope that we continue to lean in the lessons learned. And there are so many lessons learned. You know, House of Friendship had a plan about using a dormitory style situation for people and bringing in wraparound services. And it was in their 5-year plan. And I think they brought it about in less than 5 weeks. I think it was actually more like 5 days. And they were in the Radisson Hotel. And what we found was that people did better. We brought in primary care. There was safe injection needles and things if they needed it. And we also brought in housing. And I have to give a shout out to the Bridges and the wonderful people in Cambridge, because through that early pandemic period, Bridges did a lot of heavy lifting, and we housed 80 people, 80, who had been unsheltered when they were going into the pandemic. So we can do better. It costs more money. And I have to say that the federal and provincial government have acknowledged that and stepped up. But it's a much better way to get people back on their feet than a mat in a gymnasium in a church.
You know, speaking of housing and then going to transportation, and you mentioned Cambridge there, we know that the LRT phase 1 is, well underway. With the economy heading towards a certain direction, we know that we have to hunker down for the next little bit. How can the folks in Cambridge be sure that phase 2 will go ahead as planned?
So one of the observations that I would make is that nobody at the region has stopped working. And I know that many people listening to this continue to work every day. It might be at their dining room table with one of their kids off the corner of the table doing their schoolwork. But the region has continued going forward. Planning has continued to go forward. We are doing all of the due diligence that we need so that hopefully later this spring, we can go to senior levels of government and say that we've done the environmental assessment. We have all of the box checked off that we need, and talk to them about how we're going to fund this. The phase 1 of the LRT saw $3 billion of private investment along that corridor. We know that there'll be a similar result in Cambridge, and we also recognize that it's part of a much bigger vision. And one of the things that attracted me to run after I was at the federal level, at the regional level, was the fact that successive councils have had vision. And I really commend our current council for their vision. And the LRT is as much a planning tool as it is a transportation tool. And certainly the transportation is very important to us for sustainability and reducing our greenhouse gas emissions. It's 80% by 50. I had to write it down so I didn't get them backwards. And we know public transit will do that. And we know that nobody except the regional level of government can do it, because it's our responsibility for public transit. But we're also building up instead of out. And part of our regional official plan, which again, we are in the final stages of public consultation with that, is that we have the countryside line to protect our amazing townships and our farmland and our food processing and production, so that we're not doing greenfield development, but we're going up and intensifying existing roads, sewer, water, and the use of transit. So it's a much bigger picture, and it's part of why we are such a vibrant community.
I have to ask, because it is a hot button issue right now. Folks want to know about the vaccine and the rollout. When can they get theirs? Can you just give us, Do you feel the task force is working fast enough? We've seen, Wellington, Duff, and Guelph, they started their portal last week. You started your portal this week. Can you tell us about that?
I can. And, like so many things, Nicole, this would not be happening without our community partners. And I am so grateful that Shirley Hilton agreed to head up our task force. The logistics of this is amazing. And she has a team. We've got public health. We've got Ron Gagnon. The province decided that the first clinic would go in Grand River, and because of the low temperatures it needed to be at. But you have to appreciate there's scheduling, there's sequencing, there are prescribed groups in phase 1, phase 2, and phase 3 that is decided by the province. There's no hard start or stop to those phases. So it's a bit ambiguous for people from the community. But this isn't a foot race. I would tell you, we have an amazing plan. We have people from the region and people throughout this community that are working full time on making sure that we can implement this plan. We've had a bit of a trickle of vaccines. We haven't had as many as they originally thought we were going to have. We never got Moderna. We've only had Pfizer, and it's a little bit trickier. I want to give a shout out to the pharmacy techs, who are the people that reconstitute the shots out of the little vials. And they do their very best to get as many as they can out. We don't always get 6 shots, but they do their very best. None of this could happen without all of those people being involved. It's a great plan. General Hillier was here a few weeks ago, and he gave us a gold star. And I don't know if that was supposed to be for public, so don't tell anybody. But we got a gold star. And I've got a colleague from another area that phoned and asked for our playbook, because we are doing it comprehensively throughout the community. So it's not a race, and the wild card will continue to be the supply of vaccine.
Can you say who asked for the playbook?
No, I won't, just because I didn't ask them if I could. But it's a neighboring, another region.
Peel back the curtain for us. What's the war room like at the vaccine task force and at public health? Because this is the first time I know I have ever been interested in what public health has been up to on a daily basis.
So I would tell you that the leadership is amazing. The people are nimble. I think everybody is so sick of the word pivot. But even the pandemic control group, which is the original group I talked about that was built on the learnings from SARS, everybody's there. We have first responders, we have public health. Lee Fairclough represents hospitals at that particular table. Shuli is there representing public health. Sharon Ball is there representing the primary care doctors. And I have to tell you, the cooperation, Sharon put a call out when the vaccine was up and running, hoping she'd get a few doctors. And within a couple of days, she had 67 primary care doctors saying, we'll sign up. Let us know how we can help roll out this vaccine. So it isn't chaotic. Originally, it was. The pandemic control group was meeting 3 and 4 times a week. And now we're meeting less frequently. There's always emerging issues. And I feel confident that we have done as well as any area moving through this. The really hard part is what Shuli keeps saying. Dr. Wong keeps saying, wash your hands, wear a mask, stay 6 feet away, go to get tested if you have symptoms. If you're sick, stay home. And those guidelines will continue to be needed even after the vaccine, Nicole, because the vaccine, we don't know what the threshold is for herd immunity. And everybody's not going to get it at the same time.
How do you deal with social media comments? Sometimes, unfortunately, there have been some derogatory and racist comments targeted towards individuals on the public health team. And then comments about the fact that, anti-maskers. What do you say to them, and how do you deal with that?
So social media is tricky, and, it's a way to get a message out. Sometimes I just avoid social media, and there's no culpability, right? People don't necessarily put their real name in. There is no place for racist remarks. There is no place for uncivility, and people need to call it out. And it is very unfortunate. And, there's been other jurisdictions where there's been even more of a pile-on public health doctors. They are there to protect us. And you know what? I bet before this pandemic, most of us wouldn't have been able to name 2 or 3 medical officers of health. And now we rely on them. And it's that science and that evidence-based decision-making that will get us through this.
I have to ask, it took me quite aback when I was watching an interview with Premier Ford when things were going on in the United States. And he mentioned he picked up the phone right away and called Chrystia Freeland, both from different political parties, but he sort of peeled back the curtain himself to describe how, despite having different political stripes, they collaborate. Do you have a bat phone? Do you call Premier Ford, to have these conversations to speed up the process for Waterloo Region?
Yeah, I do. I have to say that both the premier, the ministers are very accessible, as are our federal counterparts. I certainly meet with the MPPs and the MPs regularly to keep them apprised. But we've passed motions, and I've talked to Premier Ford about the opening up of business and the fact that we've sent motions to the provincial government saying we want the rules under this framework about who comes out and how much business can go on, that we want the rules to be fair, transparent, and the same for small restaurants, small businesses, and big box stores. We've also put motions forward saying that pay for 6 days is absolutely essential. It was in December, even before we had any funding, that the regional government took on voluntary isolation of the cost of spaces for people who maybe live in small houses or have a lot of people in their household and couldn't isolate and may have put themselves or their family at risk. So we funded 7 rooms. $4.1 million was given to us by the federal government for 54 rooms for 18 months. So we are able to help people that may not otherwise be able to isolate from their family until they have determined that they are either through the isolation period or over COVID. So those kinds of things. I talked to the Prime Minister about vaccine approvals through Health Canada, because that would be really helpful. And he mentioned that they're working on it. I think that through this pandemic, there has been an incredible emphasis and recognition that regional government and municipalities are very legitimate, important levels of government. And I think that's why you've seen funding flow to municipalities. I look at the region supply, like we fund the police, paramedics, social services. We're the service manager for childcare, for social housing, for social supports, public health. And all of those things are very important to you and me, the businesses and the families that live in Waterloo Region. We make a difference with every decision we make.
Okay, we only have a few minutes left, I've been told, but I just have 2 last questions. First one, you talk a lot about self-care and for the importance for residents in Waterloo Region to take care of themselves. What's your routine? What do you do every morning to get yourselves ready to make the big decisions?
You know what? There's not a morning that I ever wake up and I think, oh my goodness, what's ahead of me? I wake up every morning thinking, isn't this great that I am part of this team and that we're in a position where we can make a positive change for our community. What I have done is forgive myself when I miss my Zumba workout, and don't feel really guilty when I'm only halfway through a book for my virtual book club. We have 5 grandkids, and it's really hard not to see them. They're all in town, but we know it's the right thing to do. So we celebrated Lunar New Year. We took Chinese food around to everybody and then played a family game. So there are ways to stay connected. But, I got an email this past week, Nicole, from a man who said, depressed senior. And I sent him back a bunch of links. And, mental health is a huge theme that runs throughout our community. every postal code, every demographic. And I really encourage people to reach out. There are online supports. You can get them through our website at the region. You do not have to suffer in silence. And there are lots of things that can help make this heavy slogging as we go through this pandemic easier.
Okay, and finally, you talk about the vision for Waterloo Region. Give me 4 words that would describe that vision.
So I one of the other observations that I've had beside the connectivity at the region, and I know I talked about the LRT and the planning, is also the fact, Nicole, the sun comes up every day. I can't believe March is around the corner. We have worked very hard. And you know what? Things are moving forward. We announced the Flair airline. We have a very ambitious plan for the East Side lands. We're absolutely committed to phase 2. All of these things bode well for us when we come out of this pandemic. So if I was going to say 4 words, I think I would say we're resilient. We're innovative. We're connected, and we will persevere.
Well, thank you very much, Chair Redmond, for this fireside chat. Truly enjoyed it, and I hope that the people attending this event enjoyed it as well. We're going to wrap it up now, though, and then we're going to hear from someone who will speak about Kidsability. I'll be calling Judy Narum to the stage. She is currently the incoming president for Kitchener-Westmount Rotary. She's been a part of the organization for the past 12 years, where she has been the treasurer. And you may know her from the community. She was formerly a trustee with the Catholic School Board, and she is a board member of United Way and St. Jerome's University. And right now she is the executive director for Hospice Waterloo Region. So she's coming to the stage to speak more about Kidsability. Welcome to the stage, Miss Judy Narum.
Thank you, Nicole, and good morning. It's my pleasure to be here today representing the Kitchener-Westmount Rotary Club and to be the one to thank Regional Chair Karen Redmond for presenting the State of the Region address. We live in an amazing region that is growing and thriving even during these challenging times, and that is largely due to the leadership of Chair Redmond and Regional Council, who are working so hard to protect our community while continuing to vision what our future can be. Thank you for being such strong representatives for all of us. As you heard earlier, the State of the Region event is not only a great opportunity to learn more about the future vision for our community, it is also an opportunity to raise important and much needed funds for Kidsability. As Louise noted, local Rotarians have been involved in supporting children with special needs since the 1920s. And in 1957, we helped to found what we now know as Kidsability. We are so very proud that in that time, over 90,000 children and youth with special needs have been empowered to realize their full potential. Today's event has raised just about $1,000, and it's not too late to increase that total. With every donation, a child will benefit sooner to say their first word, take their first step, and learn how to make a new friend. Please visit the Kidsability Expo booth and donate today to make a difference in the life of a child in our community. And if you missed the opportunity to donate today, the 5 Waterloo Region Rotary Clubs are hosting our online Catch the Ace raffle draw, which also supports Kidsability. And we encourage you to take a chance for a great cause. You can also visit the Rotary Booth in the Expo and learn how you can become involved in Rotary and join us in our work supporting our community. Thank you again to Chair Redmond, Regional Council, and to all of you for your participation this morning. Chair Redmond now has our final remarks.
Thanks, Judy. And I want to thank everybody for attending this year's State of the Region. We hope you've learned about our vision for the future, how we're building a community that leaves no one behind, and how we're planning for beyond COVID-19. I also want to thank Howard Pell, Kelly Miller, and Paul Pupolo from our local Rotary clubs for their leadership and advice in co-leading this event with our team here at the region. We have an amazing behind the scenes team supporting this event in IT, communications, and across the region who provided support as we pivoted to a virtual event this year and to make this event so successful. I want to thank each of them. Thank you to Rotarians Louise Gardner, Karen Voisin, Brian Bennett, Judy Narum, and Stacy Abbott for your contributions. And of course, thank you to Nicole Lampa, our wonderful moderator. I also want to acknowledge that you can still support Kidsability, as Judy mentioned, through a donation for this event through the canadahelps.org website. And finally, a thank you to my regional council colleagues for their input and participation, for their leadership in helping create this exciting vision for 2021, and for their voice in telling our story. My council colleagues are waiting for you in the expo booth to delve deeper into the subjects that we've discussed today. They cover the world-class community, equity and diversity, business supports, sustainable transportation, and affordable housing. You can chat with the members of council through the chat feature, and each session will be facilitated by a moderator. You'll also have the opportunity to watch a video related to each booth in which members of council speak about the topic at hand. We also have a Rotary booth and a Kidsability booth set up. Members are waiting for you to join and chat. You can hop from one booth to another. And again, we hope you enjoyed this dynamic event. Nobody had to search for parking this year. I really enjoyed this morning. I really enjoyed sharing some of our vision. I'll see you in the booth.